Hello everyone, let's move on to the next examination, that is the sensory system examination. So sensory system mein, one thing you have to remember is that you have to go dermatome wise. So from the bottom to the top, all the dermatomes have to be examined and they have to be examined for all sensations. That means they have to be examined for pain, touch, temperature, crude touch, pressure, as well as vibration. So it's on you to determine how good you do this examination. Most of the cases, sensory system is not something that we are going to be examining very deeply. We are going to be focusing mostly on the motor system examination because those findings are very apparent. And most of the times in government colleges, patients do not exactly respond well to the sensory examination. They don't answer well. But it becomes really essential because sensory system examination is a very pivotal role in the examination. Plus, if the patient has some sensory issues, they can directly point you towards a key diagnosis. So yeah, let me tell you exactly how do you do it. Like I told you, go dermatome wise and test all the different things. How will you touch pain? You can do the skin pinch and that will touch for the pain. Next you can do for the temperature, you can have ice cube as well as something hot, hot water cotton dipped. So you will have hot and cold sensation over there. Next what you can do is for touch, you can have the fine touch as well as the crude touch. So fine touch, you can just simply ask, touch something or touch your finger to the patient and ask if they are able to feel it. So that is pain, touch, temperature done. The pressure, again, you can apply the pressure using your tuning fork or you can apply the pressure with your hand and ask for the pressure sensation. Next comes the very essential vibration as well as the joint position. So I'll tell you how do you demonstrate the joint position to a patient. So joint position may you ask the patient, okay, I'm going to be testing this joint, and then you ask them, I'm going to be doing this is down and this is up, and ask the patient to close their eyes and tell what is it going up or down. भैया ये जो अंगूठा है ना, इसको मैं नीचे करूंगा और ऊपर करूंगा, आप आंख बंद करके रखो और मुझे बताओ मैंने क्या किया. बताओ. नीचे किया. अब सीधा. अब. So this is the joint position. You can do it for the toes, the ankle, the knee and all. So patients with multiple sclerosis, patients with subacute combined degeneration of spinal cords, patients with spinal abnormalities will not be able to respond. Especially with dorsal column issues, the proprioception is lost and this joint position will be a key determining factor. Next, you can also check for the vibration. For that, you will need your tuning fork. So I've got my tuning fork in here. Just vibrate and place it on the bony prominences. समझ रहा है? So once you place it on the bony prominences, the patient will appreciate vibration जैसा sensation आएगा. So this is one thing. समझा? So basically both the malleolus, the dorsum part of this, the shin, the knee, as well as the trochlea, the wrist, the styloid process, all of these are places from where vibrations can be tested upon. So basically bony prominences are where you have to test the vibrations from, and you all know vibrations are carried by dorsal column, medial lemniscal system, and this system is the high-fi fastest gateway of our body. So vibration is to be tested upon that. So that completes our examination for sensory nervous system. Now we are going over towards the examination of, my dear friends, the cerebellar system. So cerebellar system in one go. So cerebellar system in one go, let's finish it. Cerebellum में first of all you have to check for the finger and finger nose test. So भैया ये उंगली है मेरी, आपकी उंगली दिखाओ. ये उंगली से मेरी उंगली को छो. So this is the finger test where the patient is able to articulate where my position is in three-dimensional space and able to take it. If a person has cerebellar disease, he will be going right, left and center. He will not be having anything. This is the finger test. Then is the finger nose test. लगाओ इसको, अपनी नाक को लगाओ. अब लगाओ इसको नाक को. So this is the finger nose test. Otherwise, what will happen in cerebellar disease? They will go past or they will go before, and they might not be able to touch their own nose because cerebellum is responsible for all of that. Next test is dysdiadochokinesis. So in here, using this particular thing, we'll be able to do it. So भैया हाथ आपका ऐसे लो, दूसरा हाथ इस पे ऐसा हाथ रखो, ये ऐसे ऐसे करो. नहीं, ये हाथ ऐसे ही रखना है, इसको ऐसे ऐसे करना है. So this is dysdiadochokinesis. You have to perform it on both the sides. हो गया. Next is the heel shin test. So भैया आपका जो पैर है वो इधर लगाओ, ये वाला पैर इधर. हाँ, अब इसको नीचे लेके जाओ. ये पैर को ऐसे नीचे लेके जाओ, ऐसे लेके जाओ. वापस करो, वापस करो. Right. So this is the heel to shin test. This will again be altered in a cerebellar disorder. So these are a few tests that you can do for cerebellum, and you can check if the cerebellum of the patient is right. Next, for the gait, we'll do the gait abnormality test, in which we'll ask the patient to walk. So that is called as the tandem walking. So in tandem walking, you have to make sure the patient is good, and then you hold the patient from the side and ask the patient to walk. So that is tandem walking. And if they are deviating towards the one side or the other side, that is called as the Romberg sign. So you have to make sure that the patient is careful, they are comfortable, they don't hurt themselves after falling down. So you have to be with them when they try the tandem walking and the Romberg test. The Romberg test will be negative when you have got basically a spinal cord issue, that is subacute combined degeneration, or a cerebellar issue. So vitamin B12 deficiency, all the vegetarians watching this, including myself, we all can get vitamin B12 deficiency, and the reason is vegetables don't contain vitamin B12, it's only non-veg. So that was the test for sensory nervous system as well as for cerebellum. For cerebellum, you can also test the nystagmus of the patient, as well as you can do the cold water hot water test. So yeah, basically that concludes your cerebellum. In again, you have to do it in right and left. You have to write down the names of all of these tests. You can write down positive, negative, and for gait abnormalities, like I told you, ask the patient to walk and see what is the kind of their gait. Just to summarize a few of the gaits that we normally see in day-to-day life. One is the circumduction gait. In this, the patient will walk in a circumduction fashion because of their stroke issue. Next gait that we commonly see is a high stepping gait. High stepping gait will happen when the patient has got subacute combined degeneration of spinal cord. So the high stepping gait is going to be happening when the patient has got some sort of a common peroneal nerve issue. So the foot drop will be there, and so patient will highly step up for the foot to not touch the ground. Next thing, we'll have a gait that is called as the stomping gait, and stomping gait happens when there is subacute combined degeneration. So the patient will stomp because the patient does not know how far the land is. So these are just a few gaits to name. Shuffling gait is present in your Parkinson's disease, and you can diagnose it as the patient walks into your OPD. So these are all the different gaits that you see on a day-to-day basis. After this, the only examination that is left is of meningeal iteration, which I'm going to demonstrate right now. There are 3 signs that you have to elicit in meningeal iteration. First is the neck stiffness. So how do you do it? You just place your hand behind the patient's neck and just try to flex the neck like this, so the patient is able to do so. As you can see, the patient is easily able to do so. Otherwise, the patient's neck will be stiff in neck stiffness. Next, when you are doing the same thing, what will happen is that the patient will flex his knees like this and flex his hip like this. So this is what we famously call as the Brudzinski sign, that the patient is able to flex this hip or knee so that the neck stiffness is going to be relieving. Next is the Curring sign. In Curring sign, basically, you are taking the leg of the patient and you are trying to extend it. And see, I am able to extend this patient's leg up completely, but in the Curring sign, the patient will use the other leg, they will also flex the other leg in order to relieve the pressure on the lumbar canal. So those are the 3 basic signs of meningitis. Otherwise, fever and headache and nausea and vomiting will obviously be present. And with all of this, your CNS examination, my friends, is complete. So to revise everything, higher motor functions, cranial nerves, motor functions we are doing what? We are checking first of all decubitus, then the inspection, then the tone, the power, the superficial reflex, deep tendon reflex, plantar reflex, and primitive reflex. I forgot one thing, you are also checking the cranial nerves after the higher motor functions, then sensory examination, then cerebellar examination, then gait, and finally you have got your signs of meningeal irritation. And you have to write down exactly like this in your case sheet, and with that, all the examination of all the systems is over, and I really hope that you've enjoyed this module. Alright, see you in the next one. Bye.